Today's topic is clavicle. Before studying about any bone, you need to know about which type of bone is this, where is that bone is present in our body, how can we determine the size of that bone. Those things which help you in your external viva, because this is the easiest bone in viva. Now let's talk about introduction of clavicle. Clavicle is a long bone. Now which type of long bone is this? Clavicle is modified long bone. Now why this bone is called modified long bone? What is the special features of modified long bone? In modified long bone, there is medullary cavity is absent in that bone. Now where is this bone is present in our body? This bone is just present in our body in the breast portion, just below the neck. Now what are the parts of that bone? That bone have one shaft, as usually it is always one, and two ends. In other language you can also say two epiphyses and one diaphysis. Epiphysis is ends of that bone and diaphysis is shaft of that bone. Now we will first study about ends of that bone: acromial end and sternal end. In other language, medial end and lateral end. And why the medial and the lateral end? Because medial end are those end which is towards the midline, in lateral end are those end which are away from the midline. And where is the midline? Midline is just the imaginary line which is intersecting in our body from the vertically manner from the mid of our body. And acromial end is lateral to our body and sternal end is medial to our body. Now why these ends are called sternal and acromial? Sternal end is because this end or this bone will articulates with sternum, and the acromial end which articulates with acromion process of scapula. Now coming to the surface of that bone, this bone is having superior surface and inferior surface. Now how can we determine which surface is this? Superior surface is smooth and the inferior surface is rough. And there are two things which you can observe in inferior surface: trapezoid ridge and conoid tubercle. Now talk about shaft of that bone. The shaft is divided into two parts: lateral 1/3 and medial 2/3. The medial 2/3 is convex when we see anteriorly, and the lateral 1/3 is concave when we see anteriorly. And it is just opposite when we see posteriorly. Medial 2/3 is concave and the lateral 1/3 is convex. This diagram explains you clearly the acromion end, which is articulating with acromion process of scapula, and the sternal end which is articulating with sternum of sternum. And these joints are called acromioclavicular joints and sternoclavicular joints. Now how can we determine the sides of this bone? The lateral end is flat and the medial end is quadrilateral. In other language, whenever external asks you to hold up in anatomical position, then how can you identify which side of bone is this? And there is the shortest method. The lateral end is flat, so you need to hold that bone laterally. From where the end is flat, you need to hold that end laterally. Now how can you determine the sex of that bone? By some knowledge of that bone. In females, the clavicle is shorter, lighter, thinner, smoother and less curved than in males. But this point is not possible when you are seeing in skeleton. For that point, there is another point. In females, the lateral end of clavicle is little below the medial end, and the males, the lateral end is either at the same level or slightly higher than the medial end. If you are looking at skeleton, if the medial end is at the level or higher than that skeleton is of male, and if the medial end is below from the lateral end, then this skeleton belongs to a female. Now coming to some features of clavicle. It is the only bone which lies horizontally, because all other long bones in our body are they are in vertical manner, and it is subcutaneous throughout. It is the first bone to start ossifying. It is the only bone which ossifies in membrane. This is also a special feature of this bone, because all other bones, they are not ossifies in any membrane. It is the only long bone which has two primary centers of ossification. Now, what is primary centers? Primary centers of ossifications are those centers from which bone will ossify in fetal stage, and the secondary centers which it's only one in this bone, and the secondary centers are those centers which are from which bone will ossify after birth. Now coming to the muscles attachment of this bone, there are 5 muscles which are attaching to this bone: deltoid, trapezius, pectoralis major, sternocleidomastoid, and subclavius. The deltoid muscle is at the lateral side and originating from anterior border of this bone, and posterior border of this bone from lateral side gives insertion to the trapezius, as you can also see in this diagram. Coming to the medial side of this bone, the pectoralis major, which is originating from anterior surface, and sternocleidomastoid origins from posterior surface towards the medial end. In the subclavius muscle, which is inserting at subclavian groove.